What is up, health enthusiasts? It's Coach Lambie here for Working Weights LLC, your guide to strength, health, and all things nutrition. Joined as always by my co-host Dwayne Ulrich, aka Poppy Dwirl.
Hello.
Today we're talking about arthritis and joint pain. I knew you'd like that one.
I love it. Hate arthritis, but let's talk about it.
Yeah. But first,
as a blind mom of two, here's how I know my toddler has ripped off his diaper and peed somewhere in the house.
No, that's wrong.
That's hilarious. That's wrong on so many levels, but oh my God.
No, all right.
My wife made this soup, and I told her it tastes like shit. Tastes a lot better today.
So we moved to LA. My father gets a job at the Palm restaurant. My uncle Junior works there, who is a Jehovah's Witness.
It says approximately 48 minutes after bedtime, my toddler.
Believe it or not, he went from Catholic to Jehovah.
Oh my God.
All right.
Yeah,
Yeah,
that's some funny stuff.
48
Yeah.
minutes after bedtime,
Yeah.
the
Yeah.
stories come out. Yeah.
Yeah. Wow. The blind gal.
That's so there's a whole bunch of reels out there where they'll have a video like that, and then it will cut to somebody drinking some water, and they'll like choke on it, whatever, and then out from behind them will come this cartoon image of Jesus like looking at them. So they're trying their best not to laugh.
I'm sorry. That was funny. That's funny. That is funny.
Good stuff.
Yeah.
All right, man. Arthritis and joint pain.
Arthritis.
So,
You've been hanging out with those Ritis brothers?
yep, Ritis brothers.
You need to stop hanging out with them. Arthur's the worst. Arthritis is bad.
Arthritis.
Arthritis.
Yep. All right. So this is one of those things we talked about in our 1 year podcast, like things we want to do.
Yep.
Look into a little more. And this hits home for, many people that I know, and I'm sure it hits home for many people out there.
Yep.
And I don't know that I found anything particularly groundbreaking, but yeah, let's talk about it. So I had to bring back the old mind map. How do I full screen this? Let me full screen it first. All right. Yeah. So inflammation, joint pain / arthritis. And what are some of the things that can help alleviate the pain, maybe improve quality of life for people? Now, as far as a cure goes for things, there just isn't a cure for this. It's just something that happens. Even animals develop arthritis and have joint pain and stuff. It happens out in nature. Especially with animals that tend to live for very, very long lives. So they've even found arthritis in whales.
Yes.
So yeah, it's just one of those things. It's something that happens. It's something you got to deal with. And so getting into things. So I kind of found like maybe there was three areas we could explore. One would be exercise. The other one would be diet, because there's a lot of stuff online with regarding inflammation and joint pain and diet and stuff. And then the other is kind of like some of the other stuff. We'll get to the other stuff here. But
Right.
so
Right.
regarding exercise, so everything I really looked at was, is regarding just like general chronic inflammation or rheumatoid arthritis specifically. I didn't really find a lot of stuff on osteoarthritis, and I've only included a few in here just to simplify things, right?
Right. Right.
So as far as exercise goes, and like I kind of just stuck to the common areas that people have, see, like your hands, your knees, your hips, and I think the hips and knees also kind of goes in with the feet too. So regarding hands, so standard physical therapy. So if you were to go to physical therapy and see someone specifically about your joint pain or whatever in your hands or something, standard physical therapy or strength training, so lifting weights,
Yes.
improves quality of life and reduces pain.
Yes.
But the adding strength training to the physical therapy didn't seem to provide any additional benefit.
Right. However, the strength training has a lot more benefit than just on your arthritis. I mean, there's so many more pluses there on that side. So
Right.
I think that Coach Lambie and I were going to lean to that side always.
I would always lean to the strength, like, hey, let's get some strength training going, because it's going to improve other things. And then specifically dealing with chronic inflammation, you're going to see reductions in that chronic inflammation, which may, add to that improvement of a quality of life and the reduction of pain there. So so as far as the hands go, like anything that you might find online as far as like exercises that you could do on home just to help your hand, your joint pain in your hands,
Right.
probably is gonna do something, and you probably should start lifting some weights. Now the shoulders here, there doesn't really seem to be any reduction in pain from any physical intervention, which this is a meta-analysis right here. I don't think I'm sharing this with you, am I?
Nope.
That's fine. All right. So the effectiveness of progressive and resistance, non-progressive or non-resisted exercise in rotator cuff related shoulder pain, systematic review and meta-analysis of randomized control trials. Not really nothing exercise wise or physical therapy wise seems to help with the shoulders. And I think that like probably is in line with what we see in people's lives. Like people just, if you have shoulder pain, it just kind of doesn't matter what you do. The shoulder pain is there.
Right.
Yeah. So not to say that some people won't find some benefit from certain things. So if you have shoulder pain and, it's a joint related issue or something in the bone or the connective tissue there, you certainly should try some things and see if something works for you.
Right. So a lot of times also, I just want to say that people with who are suffering from arthritis and from arthritis pain, especially at the beginning at the outset, the common mentality there is that, well, it hurts. So why do I want to do? Why do I want to do this lifting, or why do I want to do this physical exercise or the weights? Why do I want to do that? Because it hurts. Well, yeah, maybe a little bit. It's going to be uncomfortable at first. But the point is that the outcome is going to be better for you long term. So a lot of people do is they start getting the pain in their hands, pain in their shoulder. The first thing to do is they go, let's medicate.
Yeah.
So guess what?
Medicate and rest. Yeah.
Yeah, medicate and rest. Yeah.
The rest seems to be the contributor to the worsening of the symptoms.
Yes, it does. It
Yep.
absolutely does. Yes.
All right. So regarding knees and hips, so there was improvements from all interventions, and then included stuff like Pilates, aerobic exercise, strength training, also any of the physical therapy exercises that you may receive from a PT or you might find online from a PT. All of that stuff seemed to improve joint pain. Now, it does, regarding improvements we're talking about an improvement, not an elimination, right? So
Right, right,
it's
right.
going to reduce the amount of pain that you're feeling, not eliminate altogether. And
I have
so,
read that. I have read.
yeah,
I'm sorry to interrupt you, Coach, but I've read that also that yoga helps as well. We were talking about
yeah, I'm sure it does. Yeah.
classic strength training, but the yoga seems to help on like knees, hips.
Mm-hmm.
I don't know about the rest of it, but what I saw that was an improvement, a measurable improvement.
Mm-hmm. Yeah.
Sorry.
Overall, there isn't one type of exercise. Pain relief is dependent on the person and the location of pain. However, any exercise is better than no exercise for people suffering from rheumatoid arthritis or joint
Yes.
pain. And this is
Yes.
a review of systematic analyses and meta-analyses. And so, yeah, it just kind of seems, as far as exercise goes, it doesn't seem to be that there's like one specific thing that's going to, work for everybody.
Right.
It really seems to be, dependent upon the person, dependent upon where the pain is, which joint it is, and then what that pain is related to. So maybe it's just non-specific joint pain or something. There's really no mechanical reason we can find for you having joint pain. Your joints hurt. Or maybe it's rheumatoid arthritis. So it may be that, one thing helps in one case, but it doesn't help in the other case. So you're going to have to experiment with things, and you're going to have to try different things out and see what works best for you.
Right.
Right.
Right. Right. Absolutely.
Yeah. So that's about it on exercise. I mean, it kind of like it seems common sense,
Yeah.
Uh,
Absolutely.
yeah. So Christy has arthritis in her thumbs, and she went and saw a PT, and I remember being there, and the lady who is the PT who was giving her advice and everything said, any movement in those joints is good movement. Motion is lotion. So going
Yes.
going
Yes.
back to rest and relaxation being a contributor to worsening of symptoms, that seems to be the case. It's inactivity,
Right.
and then it's decreased activity after that, which seems to be a big contributor to that.
Right.
Now,
Right.
getting into the diet aspect of this, so there's a lot of
Hey,
advice you can. Oh, go
I want
ahead.
to jump. I want to jump in. I'm sorry, Coach. One other thing that just hit me. So this is kind of coming out of left field. So when you're starting to have joint pain, like in your hands, hips, knees, whatever, uh, it's always a good idea to go to a doctor just to have it
Mm-hmm.
looked at. And here's where I'm coming from with that. So a lot of people are in jobs in their lifetime where there is deterioration in their joints, which
Mm-hmm.
isn't arthritis. It's
Mm-hmm.
just ground pounding. If you're a mechanic, if you're doing a lot of work on your feet and you're on concrete all the time, and there is deterioration in joints, especially as you get older. That's not necessarily arthritis or arthritic. It can be you can get arthritis down the line, but that's not always that pain that you're feeling. So there may be other issues there. So all I'm saying is, and Coach can jump in if he wants to on this, but all I'm saying is if you're having joint pain, at least if it's bad enough, if you're starting to feel some pains, start doing some physical activity, but also go to a doctor, just kind of get an idea, like, yeah, you got some arthritis going on. Or as opposed to like, yeah, there's no more cartilage in your knee. That's completely different. You know what I'm
Yeah.
saying? So I just wanted to
Yep.
make that clarification.
Yeah. Good stuff there. All right. Regarding diet, a lot of stuff online about this, man.
Tons.
Yeah. So there's something called the dietary inflammatory index, and there certainly does look like there's an association between diet or specific foods and chronic pain. All right, so there does seem to be so we can find associations here. All right, and so here's one example. So the association between the dietary inflammatory index, chronic pain, using NHANES from 1999 to 2004, and yeah, we see that foods that are higher on this dietary inflammatory index do tend to correlate with chronic pain within the U.S. population here. So we do need to be careful about interpreting data like that, okay?
Right.
Because number one, it is observational, and two, a lot of it is what's called cross-sectional. So we're just looking at a very small sliver in time, all right? And so you may find associations between things that are spurious or
Yep.
meaning they don't really go together. So just because we are seeing a correlation between these foods that are high on the dietary inflammatory index, and they do correlate with chronic pain. So people consuming more of those foods tend to report chronic pain more often. A lot of those foods that are high on that index are also just high in calories and very easy to consume. And so the association that we could be seeing here is not that these particular foods are specifically causing this chronic pain, but that people are over consuming them. And as a result, they're gaining weight. So increased weight can add stress on joints, even
Yes.
in your arms. And then adiposity. So body fat itself is pro-inflammatory. So you know what I mean? The association may be due to the increased body weight and increased adiposity, not necessarily to the foods themselves. So we have to be careful when looking at that type of data. So mostly what you're going to find regarding this stuff is called AIP. And there's a few different variations of this. So some of it is Paleolithic autoimmune protocols, and some of it is anti-inflammatory protocol. Whatever the name is, it kind of results in the same thing, which is basically a diet of minimally processed foods. Now some of them suggest to restrict or eliminate a lot of certain types of food. So you can see here they've got trans fats, chemical additives, like whatever that means. I don't know what that means. Artificial colors, the grains, legumes, dairy, and refined vegetable seed oils. So this one's funny too because it says processed and refined foods, and if like that probably encompasses refined sugars, grains, high fructose corn syrup, like all of this stuff up here could have just been, like included into the one thing of processed and refined foods. So, but refined vegetable oils, dairy products, legumes, grains, regarding those things now, I'm going to get rid of this.
Just having looked at, wow, that's a picture of the globe almost. Just having looked at that screen, it's like, okay, what's left? I don't know, what's left there to eat
It's an
because there,
incredibly restrictive diet. Yeah.
yeah, it's amazing, but I think that you could cut that down a lot. And not all of those affect everyone who has arthritis.
Yeah. Yes, that's true. And then the problem that I find with a lot of those diets that have a lot of those things, so many of those foods that they're recommending to avoid have been shown to lower inflammation. So regarding grains and pseudo grains, so somebody might say, well,
Yes.
what's a pseudo grain? So that's stuff like quinoa,
Yeah.
and I think bulgur fits into it. It's not technically a grain. It's a seed, but it kind of fits into the grain category.
Right.
So
Right.
stuff like that. So we have a meta-analysis right here, found no effect of whole grains on markers of inflammation in healthy adults, but it did find that if you had high inflammation, high markers of inflammation, that the consumption of whole grains actually lowered that.
Yes.
So, for that meta-analysis, grains didn't contribute to inflammation, but if you happen to have high inflammation, it actually was quite beneficial.
Right.
We have this RCT found whole grains reduced body weight and lowered inflammation in adults who are at risk of prediabetes. And those would be the people who generally would tend to have a lot of joint pain and chronic
Right.
inflammation.
Right. Absolutely.
The seed oils here, I think canola oil is probably number one on everybody's list, but this RCT compared regular canola oil to tocotrienol. Here's a quiz for you. Do you remember what tocotrienols are?
No.
It's vitamin E.
There you
So
go.
vitamin E added to canola oil. If everybody goes back to, oh shoot, what's the episode? I think it's just diet or nutrition basics number 1. Tocotrienol is vitamin E. So compared regular canola oil to canola oil with added vitamin E, and both canola oils lowered inflammation. The vitamin E, the added vitamin E, canola oil lowered it a little bit more. However, the regular canola oil lowered markers of inflammation as well. This RCT compared canola oil, olive oil, and sunflower oil, and it found that all three of them reduced inflammation, but sunflower oil had the largest reductions.
Yes. I don't really understand why, but we don't use sunflower oil a lot here in the, at least not in Texas very much, but it's really good stuff. It's wonderful. If you can get it,
Yeah,
just go buy it.
It's pretty tasty. You'll find it in a lot of cookies.
Yes. Yes. Yeah, but it does have a large effect. It is the largest reducer of those.
Sunflower oil.
Symptoms. Yeah.
And so this RCT here also compared ghee. All right, and if we were to look back, I don't know if I want to go all the way back here.
Nah.
Let's go.
It's too late. We're there.
We're there. This article would actually promote the use of ghee, the consumption of ghee. Healthy fats, pasture-raised, grass-fed animal fats, right? Fatty fish, olive oil, avocado. So they would promote the consumption of ghee. However, in this RCT, comparing ghee to rapeseed oil, which is canola oil, in patients with NAFLD, non-alcoholic fatty liver disease, the canola oil reduced steatosis, or the liver fat, blood lipids, and ALT, which is a marker of inflammation, compared to ghee.
Right.
So, yeah, so on the basis of like avoid seed oils because inflammation, well, turns out seed oils are actually lowering inflammation, even, compared to the things that they're recommending. And we find overall healthy dietary patterns tend to lower inflammation. So this is an RCT right here that assessed the effect of the portfolio diet on inflammation. And if you go back to the portfolio diet, we talked about that in regards to lowering cholesterol, your blood cholesterol. And so that diet includes whole grain cereals, legumes, low fat, dairy, and nuts. The diet in the trial. Not just the portfolio diet, but the diet they specifically used in the trial included these things, and it had a beneficial effect on inflammation. Here's a couple of reviews found beneficial effects of inflammation for people following the Nordic diet. Oh, actually, this is the review here, and then this is the link to the Nordic dietary recommendations. So people following the Nordic diet tend to have lower rates of chronic inflammation and pain. And the Nordic diet is pretty high in whole grains, beans, legumes, nuts, seeds, low-fat dairy, and they promote the consumption of canola oil.
Right, right. As does the Mediterranean, I think.
Well, this systematic review and meta-analysis finds benefits for dietary patterns such as vegetarian, vegan, and Mediterranean.
Boom.
And all of them are rich in whole grains, beans and legumes, nuts and seeds, and oils. Now, the Mediterranean diet really has a preference for olive oil. However, if you'll
sunflower.
So they'll use sunflower. So they don't the Mediterranean diet doesn't restrict or say to avoid any specific type of oil. They're just a very high preference for olive oil.
Right.
And then so the naysayers here, so the people who might promote this Paleolithic anti or autoimmune protocol would say, well, they'll also put out a lot of articles on, well, you have to be weary of where you get your olive oil from because most of it's being cut with these seed oils. Well, let's just consider that to be true. Turns out if you eat a Mediterranean diet with olive oil, that even if that olive oil is cut with seed oils, tends to be beneficial for inflammation and chronic pain.
Right.
Yeah. And then most of the recommendations from these online blog posts that you're getting don't even achieve what they suggested that they are supposed to achieve. So they'll tell you things like, get out of here. Let me scroll all the way back up here. So they'll have certain things like the thymus gland or your thyroid, your spleen, bone marrow, lymph nodes, and all this stuff, and that this diet will help to, increase uh oh, what am I looking for here? Increase your immune system, basically, right? So one of the things they talk about is people with thyroid disease, Hashimoto's or something, and how the diet can improve thyroid function. Well, even in their own blog posts, which is where I got this from, even in their own blog posts where they're saying, well, here's this, RCT showing it did X, Y, and Z, like this RCT didn't find any change in thyroid function in people with Hashimoto's. So quality of life improvements were noted, but the placebo effect can't be ruled out. And then inflammation was lowered, and probably because it looks a lot like these healthy dietary patterns, right?
Right.
As far as blood glucose goes, so they'll suggest these, to avoid all these specific foods in terms of blood glucose. Well, even in their own blog posts where they're citing articles, they cite RCTs so you're comparing two different paleo diets with a WHO reference diet, and there was no benefit on glycemic control. And ironically, the paleo diets actually included grains, nuts, and seeds, and flax oil, which is a seed oil.
Right.
And then in terms of inflammation, so again, like comparing these paleo diets to a control diet, they find that, so in this specific RCT, like there was a little bit more of a reduction in the paleo diet compared to the control diet. However, they'll say that it was statistically significant, but it was statistically significant compared to baseline. Compared to the other diet, it wasn't statistically significant. They achieved about the same results. And again, ironically, it contained nuts and oils. And then this other RCT, lower markers of inflammation for the control diet, but it didn't produce any meaningfully differences for any other marker. So overall, as far as diet goes, like choosing a healthy dietary pattern. So, even if it's going to be the AIP, I'm not going to say AIP won't lower. It certainly will, because it just fits into these categories here. But any of these things, there's really no reason to avoid a lot of the foods that they're saying to avoid, because a lot of those things actually help lower inflammation. They're not contributing to it, right? So it just seems to be that the closer you get to a healthy dietary pattern, which just generally tends to be any dietary recommendation. You look around the world, any country that's has some dietary recommendations, those are pretty generally healthy diets. All right, now some other stuff. So I didn't include everything that I found, but these were just kind of some of the things that I thought were interesting. So this RCT here found that rubbing olive oil on the affected joints seemed to help.
I have a quick story.
Yeah.
I have a relative who I'm not going to say who it is, older gentleman. That's all I'm going to say. And he was having some arthritis pain, chronically, and it was quite painful for him. And one day he came in and said, "Hey, how you feeling? How's it going?" He goes, "Oh, I feel great. Would your arthritis hurting you? Not so much. What'd you do?" Man, I tell you what, I took some WD-40 and I sprayed it on my knee and I just rubbed it in and it feels awesome. I'm not recommending that at all. I think it was more of a
so
I mean, oh my gosh, don't be doing that.
yeah. So I had an accident on my thumb here where it severed the tendon, actually, and I had to have surgery to put him back together, right? And so after surgery, there was a big knot there, so I had to go to physical therapy and everything and get the use back. And my uncle recommended to me, because he had it before, he had a surgery on his hand with his finger, and he said, man, I would sit at night, while I'm watching TV, and I would just soak my finger in baby oil and pull it out and just kind of move it around and soak it in baby oil. So I actually did that with baby oil on this thumb. And actually, like, you can see like I got pretty much full range of motion there. Now, was it, like I think it certainly helped, probably just placebo, but it,
Yeah,
helped
yeah.
with some of the pain and helped me deal with uh, doing the exercises and stuff. But
Well,
yeah, so this,
your skin can absorb things.
yeah,
I'm just
that, yeah,
saying there not everything you spray on there is good for you.
yeah. So
I'll
applying,
rub gasoline on it, man. It's
that's
great.
true. Yeah. That's true. So applying topical extra virgin olive oil, peroxicam gel, and paraffin oil. I think that's baby oil, right?
Pretty
Paraffin.
much.
Dry massaging and taking routine drugs alone were all effective in controlling rheumatic arthritis manifestations. So just rubbing some olive oil on there can help. I thought that was a little bit funny here. And this one here, manual therapy. So we're talking about massage or chiropractic or something like that. Provided some short-term relief. They don't seem to provide long-term relief. They do not provide relief as a replacement for exercise.
Yeah, and manual therapy sometimes is extremely painful because
Yeah,
they're gonna focus on that joint or on that spot, and it just hurts.
yeah. So this one here is a systematic review and meta-analysis of all of that stuff.
And you might say, well, physical therapy, I mean, just physical exercise hurts as well.
Mm.
You know what? It doesn't, you're not going to notice that. As opposed to like if it's in your finger and some guys in there massaging that joint, that hurts. But you're working with your hands and it's not as isolated. And so you're not really going to feel that kind of, most likely, you're not going to feel that kind of pain.
Um, yeah. So as long as you're keeping your range of motion and your loads and everything at a
Yes.
place where you're under pain threshold, right? So you got to work into
Yes.
stuff.
Yes. 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 Yes.
Yep. So regarding certain supplements and stuff, so what we found here in this systematic review and meta-analysis, so there are some things that did seem to help. So zinc sulfate, copper, selenium, potassium, lipoic acid, turmeric. Sorry, I always say turmeric, but it's turmeric.
Right.
Pomegranate extract, chamomile, and cranberry extracts all seem to have a lowering effect right here, about 22%, 23%.
Right.
And then all these vitamins A, B6, C, D, E, and K had that's a pretty significant. That's almost 50%. And then fatty acids, those would be the omega 3s. Those all seem to improve quality of life scores for people suffering with joint pain and arthritis. And then acupuncture. Acupuncture might work just as well as other modalities like the massage and the chiropractic. But when you compare acupuncture to a sham acupuncture, there doesn't seem to be any difference in outcomes there. So acupuncture may provide you some temporary pain relief in the same way the massage does. However, it's probably just placebo, right? It's not like doing, quote unquote, doing anything for you. It's just
Well, yeah,
you just feel like you're doing something better, and so you might experience some temporary pain relief from that.
there are a lot of people that'll swear by that, and I don't see it. I know that there's some chiropractors that do that in their practice. Again, I don't see it. Maybe short term, like you said, placebo. I think placebo is probably where I lean on that.
Yeah, I tried to find it, but I couldn't. There's a meta-analysis, systematic review of meta-analysis that I've seen before regarding knee surgery
Mhm.
and the relief of pain. And it found that like people compared to the real surgery, so people got either real surgeries or sham surgeries. So they actually will cut you open and just kind of like fiddle around in there and they won't fix anything. They don't do anything, right? And then
Right.
in the other group, you're actually getting a repair surgery. And then between the two, about 70% of the relief that people find from surgery is accounted for by placebo. So
Right.
yeah. So unfortunately, like is a lot of stuff, quote unquote, doing anything to your tissues and your joints and stuff? Like, yeah, probably not. However, that doesn't mean that you're not seeing improvements in quality of life, right? So if getting massage and getting acupuncture, cupping, or whatever the case may be, provides you some temporary pain relief and that improves your quality of life, man, get it done.
Absolutely.
Right.
Absolutely.
All right. And then yeah, as far as diet goes, just follow a healthy dietary pattern. There isn't reason to avoid a lot of the specific things people are telling you to avoid. Um and I, I may even be able to make the case that you probably could have processed foods and refined sugars and stuff as well, so long as it's in the context of an overall healthy diet and it's not contributing to weight gain and increased adiposity and stuff. So yeah.
I took a deep dive off into Rheumatology and Allergy Institute of Connecticut, and they basically focused on like about 7 or 8 different things. And two of the things that jumped out at me a lot, of course, processed foods, fast foods, kinds of things like that. But as long as it's in a healthy diet, and the data wasn't super conclusive, but some of the things that kind of stuck out for me was sweets, sweets, fatty foods, and that did not include the seed oils, just nuts, those kind of things, avocados, things like that, but rather the trans fats.
Mm-hmm.
And also, did I mention dairy?
No.
Yeah, so there is some indication that dairy can um, tend to cause or irritate inflation. That too,
Inflammation.
but inflammation. Um, and then there was a big conversation on gluten, but I'm not sure how. There wasn't anything that was really, what's the word I'm looking for? Definitive. I didn't see
Mm-hmm.
any definitive data said gluten will irritate arthritis. I didn't see that at all.
Yeah. A lot of, I mean, with everything, it's going to be individualized. So, of
Yeah,
course,
yeah,
like if
yeah.
you have a gluten sensitivity, probably avoid gluten. If you start putting canola oil on your salad and you notice that your joint pain gets worse, like, that may be reasonable for you to avoid. So, it does come down to individuality. So, just like with the exercise, certain foods cause certain people problems. Certain people have certain sensitivities that other people don't.
Right,
So
right.
it is stuff that you're going to have to experiment with on your own.
Exactly.
Overall, in the grand scheme of things, for the majority of people, this stuff doesn't contribute to inflammation or increased joint pain. I think it really does have to do with being overweight
Yes,
and increased body fat. But again, the body fat is pro-inflammatory. So you manage to get on a diet that may contain some large degree of processed foods, but you manage to lose a bunch of weight, like I guarantee your joints are going to feel better and you're going to see your markers of inflammation go down and all that stuff. So um
absolutely.
I like to talk about, so even if we were just to take the US dietary guidelines and they recommend limiting added sugars to around 10%, they don't recommend consuming added sugars, right? But if you can't seem
Right.
to avoid having added sugars, try and keep that to around 10%. And the same thing for saturated fat. Now, that means you're consuming a diet that's 90% whole grains, beans, legumes, lean sources of protein, vegetables, fruits, low fat dairy. And you do tend to have the occasional sweet thing. And I tell a lot of my clients when they come on, everybody thinks that I'm going to force them to get rid of all of these treats and everything. It's like, look, man, if two Kit Kat bars a week manage to be the glue that holds your whole diet together, then those Kit Kat bars are good for you, right?
Do you have my house bugged? That's all I
No, I
want to know.
so when I found out that I had high blood pressure, and I started looking into a lot of where the sodium was coming from in my diet. And one of the things I really, really enjoyed a lot was Snickers bars. and they tended to just, have a little bit more sodium. So I think they were around 300 or 400 milligrams for a Kit Kat bar, and Kit Kat is quite low. I think it's 20 milligrams of sodium. So that was the only thing that I could eat for quite a while as I was maneuvering into a lower sodium diet and figuring out what I could do, what I couldn't do and stuff. So Kit Kats
Right.
So that's the only reason I bring that up. So
I
that's
love Kit
that,
Kat
man.
bars.
Yeah.
Not
All
that
right.
big giant one, but the little 4-pack.
Yeah, the 4-pack. I think the wafer to chocolate ratio is messed up on the big one.
Ooh, yeah, exactly. I agree. Yes. Yes,
Yep.
it is.
The small ones, yeah, the normal Kit Kat, just perfect. The big one,
Right.
that ratio is out of whack. It doesn't feel good in your mouth.
No.
All right. Okay, well, that's about it on the joint pain, inflammation, and arthritis. Again, probably nothing groundbreaking for people. I wish I could find better suggestions to offer people, but it just is what it is. So,
Right.
yeah, probably no minds were blown, but I hope somebody's was, and I hope you guys get something from this. We'll see you next time. Coach Lambie and Dwayne out.
See ya.